So, millions of people deal with high blood pressure, right? But how do we actually fight back? Well, today we're diving deep into one of the heavy hitters in the medical playbook, losartan potassium. We're going to break down exactly how this thing works its magic inside the body.
All right, so here's the game plan for this explainer. First up, we'll look at the body's own pressure system. Then we'll see how losartan comes in and pulls off this really smart blockade. After that, we'll cover who actually benefits from it, the right way to dose it, and of course, the key risks you need to know about. We'll wrap things up by looking at what really gives it that special ARB advantage. Ready? Let's get into it.
Okay, so before we can really appreciate our hero, losartan, we have to understand the villain of our story. And in this case, the villain is the body's own super powerful system for cranking up blood pressure. When this thing gets out of control, that's where the trouble starts. So what exactly is this master controller we're talking about? It's actually this really complex, kind of beautiful cascade of hormones that our body uses to manage its own pressure. When it's working right, it's absolutely vital for keeping us alive. But when it gets stuck in overdrive, that's the core problem that a drug like losartan is built to solve. And it has a name. It's called the renin-angiotensin-aldosterone system, or much easier to say, RAS. Think of it like your body's internal thermostat for blood pressure and how much fluid you're holding on to. The problem is, sometimes that thermostat gets stuck in the on position, and that leads straight to hypertension. The whole thing is basically a chain reaction, right? It all kicks off when the kidneys release something called renin. That release triggers the creation of this incredibly powerful molecule, angiotensin II. Now this is the main player. It squeezes your blood vessels tight and basically yells at your body to hang on to salt and water, and boom, your blood pressure just skyrockets. And that is where our hero, losartan, makes its grand entrance. See, it doesn't just randomly lower blood pressure. Oh no. It pulls off a really precise, super smart blockade exactly where it's needed most. Losartan is part of a drug class called angiotensin II receptor blockers, or ARBs, and its whole job, its entire purpose, is to find the specific docking station for angiotensin II, that's the AT1 receptor, and block it. It's literally like jamming the wrong key into a lock. That way, the real key, our troublemaker angiotensin II, can't get in and do its damage. So what happens? It's a total reversal of fortune for angiotensin II. Where angiotensin II constricts blood vessels, losartan swoops in and lets them relax and widen. Where angiotensin II ramps up aldosterone and tells the body to hold on to sodium, losartan just shuts that down. It's a perfect countermove. Now, this is maybe the most important part, how it's different from those other drugs, the ACE inhibitors. See, ACE inhibitors work a little earlier in the process, but they have the side effect of increasing a substance called bradykinin. And bradykinin is famous, or maybe infamous, for causing that nagging, persistent dry cough. Losartan and the other ARBs, they don't mess with bradykinin at all, and that makes them a fantastic alternative for anyone who just can't deal with that cough. All right, let's trace its journey really quick. Once you take it, it gets absorbed and starts working. But here's the cool part. Losartan is what we call a prodrug. That means the liver actually converts it into an even more powerful active form, this thing called EXP3174. And this active form sticks around longer and really does most of the heavy lifting. Okay, so we've got the how down, we know the mechanism. But now, let's talk about who. Who is losartan actually for? Its mission is aimed at some very specific and very serious conditions. So its primary gigs are treating hypertension and heart failure. And like we just talked about, it's the go-to choice for heart failure patients who can't tolerate an ACE inhibitor. But it has other super important jobs too, like protecting the kidneys in people with type 2 diabetes and even helping to reduce the risk of a stroke. All right, but using this powerful tool isn't as simple as just taking a pill. It's not a one-size-fits-all kind of deal. The dosing strategy, the rules of engagement, if you will, has to be managed super carefully based on the mission. And of course, the patient. You can see the starting point is really different depending on what we're treating. For high blood pressure, it might start at 50 milligrams, but look at heart failure. We're starting way down at just 12.5 milligrams and then slowly, carefully increasing it over time. This whole start low, go slow idea is absolutely crucial to keep things safe. But every hero has a vulnerability.
right? An Achilles heel. And for losartan, that comes in the form of a few key risks and interactions that doctors and patients absolutely positively have to know about. The most common side effects really just come from what the drug is designed to do. Since it lowers blood pressure, well, sometimes it can make you feel dizzy or cause hypotension, which just means your pressure drops a little too low. It can also cause the potassium levels in your blood to creep up, a condition we call hyperkalemia. Okay, listen up, because this is the single most important warning. Losartan is absolutely 100% contraindicated in pregnancy. This drug can cause serious harm or even be fatal to a developing baby, especially by damaging their kidneys. I really can't stress this enough. And you have to be careful what you mix it with because it doesn't always play well with others. For example, if you take it with potassium supplements, you could push your potassium levels right into the danger zone. Even common painkillers like ibuprofen can make it less effective and put your kidneys at risk. And for people on the mood stabilizer lithium, it can cause those levels to become toxic. So because of all these potential risks, monitoring is it's not optional. It's non-negotiable. If you're on losartan, you need regular checks of your blood pressure, your potassium levels, and your kidney function. This is all to make sure the medication is doing its job safely and effectively. So after all that, the good and the bad, let's bring it all home. What is it that truly makes losartan and its whole class, the ARBs, such a valuable tool in medicine today? What's their main advantage? All right, let's boil it all down to the absolute must-know high-yield points. Remember, it's a prodrug. That active form EXP3174 is key. It's the go-to alternative for people who get that dreaded ACE inhibitor cough. It's a fantastic kidney protector, especially for diabetics. And the two giant red flags? Absolutely avoid it in pregnancy and always, always watch those potassium levels. If you remember anything, remember that. Which leaves us with one last really interesting question, doesn't it? When you think about it, losartan is this well-tolerated powerhouse, and it doesn't have that annoying cough that its biggest competitor has. So, why isn't it always the first choice for everyone with high blood pressure? Well, that's a whole other debate that gets into medical history, cost, and some massive clinical trials. But that's a story for another day.